Hi, hello everyone. I'm Sergi Navarro. I'm the principal investigator of Palliakid project and head of pediatric palliative care unit at Hospital Sant Joan de Déu in Barcelona. And I really wish I could be there with you in Manila, but unfortunately I couldn't make it. I hope you have a great Congress, and also I'm glad that our ambassadors from Palliakid and the hospital are there. I'm happy to be part of this Congress with you. So Palliakid is an interdisciplinary and international project aiming to develop pediatric palliative care for non-oncological diseases. And we like to highlight this special or active involvement of patient and family caregivers, as you will see during my presentation. The project brings together 17 partners from 10 countries with a 7 million budget over 4.5 years, and is funded by the European Union. As mentioned, is a collaborative effort to improve care for children with life-threatening or life-limiting diseases. We have on board different leading hospitals, 5 clinical sites. We have also universities and research centers. And obviously, we have on board 2 international associations in the field of palliative care, specifically in pediatric palliative care, as it's the ICPCN and the European Association for Palliative Care. As well, you all know that more than 21 million children globally requires palliative care, and more than 8 million need specialized care during their illness and specifically during the end of life period. And well, in Europe, you also know that around 170,000 children in need of palliative care die yearly without access to it. And we want to highlight the urgency of strengthening and harmonizing services. Unfortunately, as you know, there are a lot of things still to develop in pediatric palliative care, and we have in some cases some kind of, let's say, lack of consistent data. And what is most important, we have unequal access across European countries. Here, as you can see in this picture from our kickoff meeting, this is precisely why we came together as a consortium to face these challenges in a collaborative or collective way. And we have the expertise of different partners, countries, disciplines, trying to find solutions together. Well, what are the main cornerstones of Palliakid? Our work is structured around these 3 cornerstones. You will recognize because you live with them daily, practically. And we need an early identification of those patients. We still receive patients in a really too much maybe advanced disease. And we want to identify, or we think that we need to identify those children in the early stages. We also think that we need to improve in the advanced care planning and with better need assessment tools, and well, to trying to elaborate an individualized care plan. So our solutions, or the proposal, we thought that maybe an early detection system using machine learning or artificial intelligence and algorithms, maybe we can identify patients with pediatric palliative care needs in an early stages. And also another digital solution, we think that we can adapt those tools. We have on board in the consortium the main authors of the impact tool, what is an advanced care planning tool to have those conversations, those difficult conversations, and also the XCOM tool, that is a tool validated in adult population. So we will try to adapt those tools, and in the case of XCOM, trying to validate it in pediatric population and adapt those tools to different cultural environment. We have clinical sites from the north, the south, and the east of Europe, and those tools will be integrated. In a digital platform that will allow to connect professionals with children and families, and also siblings. Those solutions will have two major clinical trials. The first will start in May approximately. Is a two-stage study to develop and clinically validate this early detection system to identify children and adolescents in need of pediatric palliative care. And the other clinical trial will be what we call the Palliakid intervention, a multicentric randomized control study to verify the feasibility, effectiveness, and cost-effectiveness of the Palliakid intervention with this digital platform, with those tools adapted, and versus the standard of care for the need assessment and advanced care planning. And it will take in 5 clinical sites. Well, as you know, those projects are divided in different work packages. And just to highlight the work package 2, as mentioned before, that we have a specific work package to ensure that patient and family caregivers are engaged, are empowered to participate not only in reviewing the protocols, the clinical trial protocols, but also they have participated in the co-creation sessions, as I will show you in the next slides. So far, we have identified for this early identification, we have identified and validated key variables across different sites. We have completed this retrospective data collection and developed the first version of a machine learning model. And we have also carried out co-creation workshops, as mentioned, with patients, siblings, and caregivers, and also with healthcare professionals. We have conducted, as mentioned, the co-creation workshops and living lab sessions with them. And we think that this has been crucial to refine the approach and the specific tools. The project started in December 2023, and we hope it will continue until May 2028. So we are in the 24th month. We have, as mentioned here, you have the timeline. We have already completed the first rounds of co-creation, and the next steps will focus on further developing the detection system and advancing in the clinical studies this 2026 year. And well, to conclude, just to thank you. It's been a pleasure to participate in the Congress, even from Barcelona, online. And I know this has been just an introductory overview of the project. We have done a lot of work, and just say again, thank you. I hope you enjoy the Congress and hope to see you all soon. Bye-bye.